We just heard from San Francisco Mayor Breed about how important it is to rely on experts, and we have two of them with us here today for our next session in discussing how to prevent the next pandemic. Dr. Brilliant is an epidemiologist well known for his work with the World Health Organization in eradicating smallpox. He is CEO of Pan Defense Advisory and chair of the Advisory Committee Ending Pandemics. Dr. Wen is an emergency physician and visiting professor at George Washington University Milken School of Public Health. She has also served as health commissioner for the city of Baltimore. Welcome to both of you, and thank you for being with us here today. Dr. Brilliant, I want to start with you. We are currently in an unprecedented situation where countries around the world are under social lockdown. Businesses are closed, schools are closed. But this doesn't entirely surprise you, does it? Because you have countless times warned us that this could happen. Why are we so unprepared against invisible viruses and pathogens?
Well, thank you very much, Allison. I'd like to say how much I enjoy sharing the split screen with Dr. Wen. If I could just say, listening to Tony Fauci, who is a national treasure, he has just delivered a clinic on the question of when do you shut down, when do you partially shut down, and when do you open up. What he has just spoken about should be played in every medical school, in every boardroom, every governor's office, and all throughout the White House. It's a terrific description of the issues. If I could compare it a little bit to smallpox eradication, and they're not comparable. Different virus, and we had different tools. We had vaccination, and we didn't need tests because you could see on the face of any child who had the disease or in the morgues the number of deaths. But there is a little bit of a difference between the idea of mass vaccination, which brings down the speed of the virus, increases herd immunity, and then prepares you for what Dr. Fauci said was the next phase, where much of a country could be opened up because they've got herd immunity. But instead what you do is you then find every single case, do complete contact tracing. In the case of smallpox, you then draw a circle around them, a ring of immunity. We don't have a vaccine, but using testing, we can find every case, and then we can draw a ring of absolute quarantine around every one of those cases and contacts. This is not the laissez-faire Swiss cheese kind of social distancing that we've talked about. They're not comparable, but they are illustrative of what we face before we can open up parts of the country. We have to have sufficient testing, contact tracing, and then real quarantine to protect us. Then the rest of the world that we have can begin to get normal again.
Dr. Wen, you've had experience in our nation's public health system as health commissioner of a major metropolitan city. So I'd like to bring in some questions. We got hundreds of them from our readers to ask both of you. And I wanted to bring in one from Jitendra here in the US. How can we improve our public health and security infrastructure? Should there be a separate federal agency for health security? Would love to get your thoughts on that.
Well, I very much appreciate the question, and it actually brings up, and Dr. Brilliant's answer also brings up there's a saying in public health that public health saved your life today. You just don't know it. That so much of the work of public health is invisible by definition. I mean, we're successful when we can prevent these outbreaks. We are successful when we can, as Dr. Brilliant said, put a ring around these infections and prevent them from spreading. We're successful when we can remediate housing and prevent that child from being lead poisoned. The problem, though, is that when public health is invisible, we become the first item on the chopping block. And when you look at local public health and what's happened in recent years, I mean, we've lost tens of thousands of local public health workers. We have had just this years long of disinvestment in local public health infrastructure. And all of that is becoming very obvious in the case of the COVID-19 pandemic. And so I don't think what we need is to have new infrastructure being put up, to the viewer's question, but rather what we need is to have investment in public health and to really put the face on public health, to make public health visible. Public health needs to be at the table for every decision, because ultimately fighting for the public's health is about health and well-being, and it's also about economic security and about national security.
And this is a point that both of you have made, but as we talk about how we prepare ourselves to prevent the next pandemic, it always seems that when an outbreak occurs, we go in crisis mode. There's a lot of attention, there's a lot of political leadership focused on it, there's a lot of funding. And then when the cases wane, as they inevitably do, all of that disappears. So we have a question from Marcia here in the United States about, after this crisis wanes, how can we sustain the will to change public health for the better and be more prepared and ensure that we have more equal access for future crises?
Do you want to answer that, or would you like me to? Dr. Wen?
You can.
I think that's a question either one of you should pick up.
Well, I'll give it a try then. Echoing what Dr. Wen said, another thing we say about public health is that public health is about nothing, because we succeed when nothing happens. But how much would you pay to have no fires happen, no burglaries happen? That's what public health does. It's so that no epidemics or pandemics happen. So taking a step from what Marcia's question was, in order for us to be able to do our job so that nothing happens, I'd like to say nothing bad happens, we need to reinvestigate, reinstill, and refund the public health infrastructure, not just in the United States, but if we're talking about pandemics, because they begin anywhere in the world, we need to support the World Health Organization full bore. We need to look at the countries that are failed states or that have insufficient healthcare systems and exist in what we call hotspots, the places in Africa from which bloodborne diseases have historically arisen, like Ebola, the places in South Asia where historically respiratory diseases like Asian flu and bird flu have arisen, and now SARS, and the places in South India, South Asia, where cholera and other foodborne diseases have occurred. We need to support those healthcare systems, and there are organizations like CORDS, which connects regional disease surveillance, many of the WHO, FAO, OIE, which is the World Health Organization for animals, that we should be supporting. This is not a time for us to think we can stop this disease only in San Francisco or New York or at the shores of America. We have to be good citizens on a global basis.
And I would add, too, that in addition to the global work that we have to do, understanding that diseases know no boundaries, there's also a lot that we have to do within the U.S. as well. If it's anything that this pandemic has taught us, other than what happens when we do not invest in public health, it's also unmasking so many underlying health disparities and what happens with the history of racial discrimination and racial inequities that are present in our healthcare system too, in our overall systems. And so while we address these acute issues and stop deaths and stop infections, we also have to be turning to these chronic conditions, these chronic issues related to social determinants of health and longstanding disparities that we must correct also.
And as we look ahead for what changes might need to be put into place in order to adjust to the new normal, as we come out of this pandemic, we have a question from Edward in Spain who asks, how will the world change, or will it all be the same in 3 or 4 years? I'd like to ask both Dr. Wen and Dr. Brilliant about what you envision will be different about our lives. Will it be normal, or will it be a new normal?
I mean, I do think that in the short term, we will continue to see many changes in our daily lives. And I want to acknowledge the huge sacrifices that everyone has had to make, whether it's individuals, kids who are not going to school and the impact on their parents and the impact on so many who have lost their jobs and have had to really make huge sacrifices for the betterment of society. I think we'll continue to see a lot of changes related to how we interact with our world. There'll be changes to our workplaces, changes to our schools in the short term. And I think that longer term, the hope that I find is that we'll see why investing in public health is important. We'll see why the voice of science and health needs to be at the forefront with voices like Dr. Fauci's and Dr. Brilliant's. And I also hope we'll see just how interconnected we all are and how our futures are tied to one another. And our resilience in this time is one that gives me inspiration and hope, but also is the path forward for our country and our world.
And if I could add to that, I would say what would give me hope, and this is hard for people to hear, but it's a good thing. I would like to see a 3-year plan or a 5-year plan at the national level and at the global level. And it doesn't mean I don't think that we will be we wouldn't be loving or going to the store or going to sports for 3 years or 5 years. But we have to be realistic. When Dr. Fauci says it's 12 to 18 months until we get a vaccine, that doesn't mean in 12 to 18 months there's rainbows and unicorns. What you get after 12 to 18 months of getting a vaccine is you get a vaccination program. So I draw comfort from the polio eradication program, from the smallpox eradication program, that even after you came down almost to 0 cases in both of those instances, in the case of polio, they extend that period of observation and surveillance by 3 years to be sure they didn't miss anything and the virus could come back. In smallpox, we waited 2 years, going house to house, every house in the world, to find any hidden cases for 2 years after the last case. We're going to need something not maybe as extensive as that, but we're going to need something similar to that. And the sooner we start looking at the holistic, reasonable time frame that we are going to be dealing with this virus, not in the way we're dealing it now. I don't mean lockdown. I don't mean the loss of the economy. I don't mean that joblessness. But if we don't plan for 3 to 5 years, we will be giving ourselves a false target. And if I've learned one thing about epidemics, they are not date-driven. They are event-driven. And we need to be very careful about how we do date-driven mandates.
Dr. Brilliant, I want to just pick up on that point and ask you about some of the lessons that you learned from your extensive experience with smallpox eradication. Do you see those lessons being applied in our response to COVID-19? And if not, why not? And how can we ensure that we have learned from our previous experiences with past outbreaks?
Well, I think in some ways, all of public health has learned from smallpox eradication and polio and everything that's come before us. So we are an iterative and aggregative field for sure. But there's some very big differences. In smallpox in India, with 150,000 search workers, enumerators, or contact tracers, 150,000, the largest peacetime army that the UN had at that time, we went door to door and made 2 billion house calls and found every person who had not been vaccinated, or in this case, was not quarantined. And we applied the then prevalent measure, vaccination, now quarantine, until we have a vaccination. I don't think that we are understanding what it will take as a nation, all 50 states, working with the federal government to do the kind of contact tracing, follow-up testing, and containment that we will need. That word that Dr. Fauci used is a word we used in the smallpox program. Surveillance and containment, finding cases and containing them. That cadence, I think we need to learn better. But the most important lesson from smallpox eradication, and the title of our session today is Hope. What gives me hope and makes it impossible for me to be a pessimist is that I saw the last case of killer smallpox in nature. And when that little girl, Rahima Banu, when the scabs fell off of her and they died in the hot sun of Bangladesh, that was the end of a chain of transmission going back 10,000 years of a disease which killed billions of people, 2.5 million during our summer of love, 500 million, 500 million in the 20th century. When those scabs fell and they were cooked by the sun, that was it. That was the end of one of the worst diseases in human history. That's the lesson that I want us to take. We can do that. We did it in smallpox with people of all colors and races and religion coming together in a global effort, all of us against the virus. That's what we need now, and I am optimistic that we can do it.
And it will definitely take a very strong, as Dr. Wen argued, public health force to do that and health system to do that. Dr. Wen, you very, very recently gave birth, so congratulations. You documented your delivery, and did being a patient give you a different perspective on ways that we can further strengthen our healthcare system against the next public health threat?
So thank you, Alice, for mentioning this. I have a daughter who is now almost 3 weeks old. She'll be 3 weeks old tomorrow. And I gave birth at the same hospital that I gave birth 2.5 years ago to my son. And it was a completely different experience, very different in how I approached pregnancy and delivery. I mean, whoever thinks about planning for giving birth in the middle of a pandemic, there were guidelines that changed seemingly from week to week. And I was worried until the last minute that perhaps my husband would not be able to be with me in the delivery room. It turned out that he was. But there were so many patients in our hospital and hospitals around the country and the world that now cannot have someone with them in this incredibly vulnerable time, whether it's pregnancy or having surgery or being a patient with COVID-19. And it just makes us realize that healthcare continues to happen in the middle of a pandemic, that it's not only the patients with COVID who are affected, it's really all of us who may have a health condition, may need to go see our doctor. And to your point about how it changes the perspective as a patient, I mean, I worried so much about my healthcare providers. I was worried about them and I was worried for them. There was a doctor and a nurse in the OB unit who had just been diagnosed with COVID. And a number of other doctors and nurses were out because they were out for exposure reasons. And I also didn't know whether my doctor and my nurse and the techs had COVID-19. And at the same time, I was worried for them. They were being issued one mask that had to last them the entire week. And I could see the mask already fraying after a few days of wear. And I worried that they could be contracting the disease. I worried about what their families are going through. And frankly, I worried about me and the other patients who were there. And I think these are just the new concerns that are present in the doctor-patient, provider-patient relationship that we might not have considered. And I think part of this new normal and the uncertainty that all of us are living with during these times.
And I wanted to ask you then, as you see the U.S. response to this pandemic, and as we look ahead at what we can do to prepare ourselves for the next one, are you optimistic that we have structures in place, that we have some lessons to learn from this response that will make our next response to the next outbreak better? And that's for both Dr. Wen and...
I hope that... Alice, I mean, I hope so. I hope that we will not be complacent afterwards. I hope that we will look at the lessons. We will look at the importance, for example, of widespread testing, of implementing these aggressive social distancing measures, of having contact tracing, as Dr. Brilliant mentioned, and having this army of public health workers who can do the important work that's needed to contain this illness. I hope that we will look at these longstanding disparities and now have the impetus to address them. I just hope that we'll continue to push forward with urgency and action, even after the immediate crisis is resolved, and that we will not move on to the next shiny object and forget how much suffering people have gone through and how many preventable deaths there were during this pandemic.
Dr. Brilliant?
I'm optimistic that we can. I'm concerned that we won't. And as our parents taught us, a stitch in time saves 9. We're seeing that a stitch in time saves trillions of dollars, and it will be millions of cases and hundreds of thousands, if not millions of lives. But we forget. History is replete with us forgetting. I think we have to behave as if we know that there is another pandemic coming, and one after that, like airplanes circling the old LaGuardia, looking for a place to land. And that's not pessimistic. That's because science tells us that every year, 1 to 3 novel viruses leaps from animals to humans because of modernity, because we clear cut the forest, because animals and humans live in each other's world now closer than ever, because we eat more meat, and especially in some places, more bush meat, because we can travel quickly around the world, as Dr. Fauci said, and carry that novel virus everywhere. So the facts are pretty clear. 1 to 3 new novel viruses jump from animals to humans every year. Now I ask, is our response proportionate to the risk of facing another disease like this 5, 10 times in the next decade? What about in the next 20 years in our children's life? Surely we've learned the lesson this time, which is why I'm optimistic that we can, that we will put the resources, train the people, arrange the institutions. So the next time we won't have, as we have in this case in the United States, a 6 to 8 week head start given to the virus, that we will think in 5-year plans or 3-year plans or 1-year plans and prepare ourselves for it, what is inevitable, but need not be catastrophic or as awful as this if we plan for it.
Thank you, Dr. Brilliant. Thank you, Dr. Wen, for sharing your expertise on this public health crisis and for giving us hope about ways that we can find to navigate this pandemic and the next one. I'd now like to bring back my colleague, Edward Felsenthal, who's going to be joined by Angelina Jolie. Edward?
I'm so happy to have with us Angelina Jolie, who is not only, of course, a brilliant actor and director and special envoy of the UN High Commissioner for Refugees, but a member of the TIME family as a contributing editor and columnist. Angelina, thank you so much for being with us.
Very, very happy to be here with everyone.
You're at home these days, as most of the rest of us are?
Yes, we're all locked in and doing all right. Yeah.
Doing all right.
Yeah.
You wrote a powerful column in our most recent issue, Finding Hope, about really making the point that even though the virus itself seems to mercifully spare children, kids are being exposed in other ways that are going to force us to urgently rethink how we protect children in the days and months and years ahead. Can you talk about that and the point you were seeking to make in that column?
Well, I mean, as you know, long before the virus, we had so many children in need across the world. I work with UNHCR, and there are about 30 million children who are uprooted. Before the virus, we had over 258 million children out of school. So we had a crisis bigger than we could manage long before. Now this, and now the numbers so rapidly have risen. 1.5 million out of school in need of help. The World Food Program speaking about possibly a famine of biblical proportions. Having been in the field and seeing how these people exist and how they depend really daily, moment to moment to survive, I certainly can say I understand how just a little pull in that fabric, how things fall apart. It should never be that vulnerable. We should never have children around the world that vulnerable. We should not be in this state.
I think we've all felt, I know I have a sense of relief. And I mean, just to imagine if the virus itself did affect kids in significant ways, how devastating that could be. But it has pulled the focus away from the, I suppose, secondary or indirect and very powerful impact on kids, and especially girls.
Oh, yes. Well, as we know, I have a few girls' schools around the world, and
Right.
To get them started wasn't easy. And to encourage in Kenya, Afghanistan, Cambodia, to get them started, to encourage the family members to send the girls, to prioritize the girls' education over how they may be considered useful at home, or or those who are considering marrying their children off, their daughters off. So you can imagine what we know happens to girls. We know from the past that it doesn't take long, a week, and there are more child marriages, a week, and there's already more forced labor. The violence across the world, and I know, and I'd like to speak about that as well in America, the hunger in America, the violence in America, but across the world, vulnerable children. So for many children, as you pointed out earlier, that yes, they're not as directly impacted by the virus, but the secondary impact, the being locked within a home with an abuser, the being locked within a home unable to access that school meal that was your one big meal of the day that kept you from hunger. 1 in 7 American children. It's unbelievable. 1 in 7 American children are that close to going hungry.
Right. Yes. School provides so many key resources to kids beyond education, right? So how are you in the schools you work with? How are you and they looking to handle that remotely, or finding alternative ways to help these kids while they're not in school?
Well, the two most different, the two things that affect children from my view the most, being out of school, of course, the education and the challenges with education. I know parents across even this country are challenged with homeschool, and that's maybe more of a challenge on the parents than the children. But yeah, for the children, it's the food insecurity that affects 11 million children, severe insecurity, 11 million children, 20 million on these food stamps and dependent. And it's domestic violence and abuse. We've seen the numbers go down. I believe it was even last checked, it was about 40% less calls in and information reports of child abuse. And we know it didn't go away. So why that number for people who work on this issue is so upsetting is because it means these kids are trapped. Nobody can see them. When a child goes to school, it is a place where you can temporarily get away from the violence or the horrors if you live in one of those homes. But it's also a place for the bruises to be noticed, for a child who's a child maltreatment to be witnessed, and for it to be called in. So these are things, and we know domestic violence is on the rise across the world because we're hearing horrible reports. So within a home can be the most dangerous place in the world for many people.
And there has been, I think, you've written about growing a recognition of even in the United States, the massive inequality, and that is driving so much anxiety and political change all over the world. And this crisis has, I think, shown all of us, what the front lines really look like, who's on them. We did an issue a couple of weeks ago celebrating the heroes of the front lines, and some of the, I think, very fair feedback we got was, it's great to celebrate us and call us a hero, but pay us $20 an hour for the work.
That's right. That's right. There's a lot we have to improve wages, to improve the stimulus package, which is something we need to do quickly, urgently. And it is, I think, maybe to your point, it's about respecting people. It's not just for this moment to applaud the people who are doing so much work, but real respect and real equality. When people say, I think about that often, somebody says, I believe in equality. Well, what does that really mean, to believe all people are equal? You believe all people are equal, then you can't be okay with how so many people are being treated. And so this is a time for outrage, for grand change across the world. When I was reading the reports about America and what was happening with hunger in America, I felt like I was reading a UN report. I couldn't quite, it actually shocked me. I thought something had gotten confused. I couldn't understand because we don't have the same challenges other countries have where they're in a famine and they don't have access to certain actual food. We have, as you say, it's this inequality. It's a not making possible for families to survive and work and feed their children.
Well, one thing I wanted to ask you about, I mean, you, in ordinary circumstances, you must be on the road. I know you're in far-flung corners of the world with your advocacy and have been for a couple of decades. What is it? Well, let's start with the advocacy. How is this isolation affecting the work of people like you who are normally out in the field on both sides? You know, the activists and those who are who you're out trying to help. You know, what does relief work look like right now while we're all locked away?
Well, I mean, very, very different for me than many in UNHCR. My colleagues who are on the front lines in the camps are still there, and they're there every day. Thousands of them working across the world in over 128 countries to bring assistance to people. And as you know, the camps there's a real question right now. So far, thank God we haven't had cases across the camp, but if we do, it will spread far and fast. Everyone is working very hard to try to do, sanitation stations and hand washing, and camps have always been, UNHCR is always with very, very little funding and very high numbers ever growing. UNHCR has done its best to try to manage and help the people. We're protection agencies. We try to find a secure place. We try to manage it. We work with all these other wonderful UNHCR. We work with other wonderful UN and NGO actors across the the countries that we work in. But the scale is on another level. So I'm trying to support them. I'm trying to work with them. I'm working with the High Commissioner. We're trying to see what we can do. But I think most people are in quite a lot of shock. And as I said, we could hardly do our work and meet the needs before. So this is really a frightening time, truly a very, very frightening time. It's hard what the suffering from all of the changes that will come with this virus, the economic changes and the food shortages are really hard to imagine how bad it will be.
The theme of this TIME100 talks and of the issue that you contributed to is finding hope. And I fear, thinking back over our conversation the last few minutes, we might sound hopeless. What gives you hope? What personally and in your work?
Well, I do. I spent so many years working with refugees around the world, and people say to me, that must be very hard work or very, very upsetting. And honestly, of course it is. But they have also taught me so much about resilience, about family, about what life is truly about. And I have seen people overcome insurmountable odds with grace and so much unity and so much love and so much this. So I believe in humanity. I have hope. And I think we really can't afford not to have hope. So I think when people are aware, and if they can have a path forward, guiding them with how to help and what to do, they will. I believe they will.
Well, that seems like an appropriate and uplifting place to end. Thank you so much for being with us and for your contributions to Time and for your work around the world.
My pleasure. Thank you so much.
We've committed $50 million to the response to COVID-19. This is a crisis that requires urgent action. We're bringing together industry, science, and government to rapidly scale up access to testing so vulnerable families and essential workers can go back to work and be safe as they do so. Our first priority is putting in place an early warning system that would allow visibility of data when outbreaks occur and science-based decisions about sounding the alarm for when a global pandemic is a real threat, so this type of crisis simply doesn't happen again.
I'd like to welcome Rajiv Shah, president of the Rockefeller Foundation, who's here to discuss the program that you just heard about, an action plan for improving testing capacity here in the United States and potentially around the world. Raj, you have said we envision an America where everyone who needs a test can get one, and testing for COVID-19 has been a struggle here in the United States. Tell me about the gaps that you saw in the country's ability to ramp up testing and then implement it, and what role the foundation is playing in addressing that need.
Sure. Well, thank you for having me, Alice, and thank you to your participants and to the TIME team for putting today together. This is a moment where we all need hope, and we need to see that there is a better way out for our country, for our economy, and for the working families in the United States. And right now, the Rockefeller Foundation believes that way out is fundamentally about testing. We're losing $300 to $400 billion per month in lost GDP output. And while that's a big number, the real consequence is that 73% of Americans have already reported a significant and permanent loss of income. And 50% of Americans are in a position of choosing between their lives and their livelihoods, in the sense that they have to continue to work in order to make ends meet during this very critical time and take real risks in doing so. Really, the only way our country is going to deal with COVID over the next 12 to 18 months, before there is a widespread vaccine available and administered, is going to be making sure there's broad, ubiquitous testing available for every American, and especially for groups of asymptomatic people who either need to be in the essential workforce or have had some known contact with someone who's been COVID positive. And right now, the guidelines are very, very restricted. They're restricted by the fact that America has probably one of the lowest levels of testing availability around the world for its population.
Why is that? Why has America had this delay in being able to test more people? We've seen smaller countries really ramp up their testing capacity. Where do you really see the gaps? Is it an issue of technology? Is it an issue of infrastructure from the healthcare system? Is it an issue of regulations that prevent commercial labs and academic labs from picking up the mantle? Where did you see the gaps, and how does your action plan address them?
Well, the gaps are all of the above, as you mentioned, and the Rockefeller Foundation was able to bring together scientists, industry leaders, listen to manufacturers in particular who are now tasked with scaling up to levels they've really never produced test kits at. And we worked with cities and states around the country to develop a clear action plan. The plan is the 1-3-30 plan. Right now, we're stuck at about 1 million tests per week. We've been at that level for about 3 weeks. We think we can get to 3 million tests a week in just 8 weeks' time, and that would be transformational for helping economies reopen across the country. And the way we would do that is to bring on board the roughly 2/3 of molecular testing capacity in America that resides in small labs, in research labs, in university labs, that could be processing more tests, but frankly are not a part of the Centers for Disease Control surveillance and diagnostic network, and are usually not connected to an information system that allows for people to send them requests to process tests and allows them to send results back to those who need them. So that we see as a very solvable problem. We've proposed some very specific insurance reimbursement changes. And we've asked insurance companies come together, say, we're in a national crisis. Let's wipe away the distinctions between an in-network or out-of-network lab, provide a consistent flat rate reimbursement for every test that's completed, use every bit of lab capacity, whether it's at a university or in a corporate lab, and let's quickly get from 1 million to 3 million, which we can do in the next 8 weeks.
And how do we get from 3 million to 30 million? What will that take?
Well, that's going to take a lot more of a transformational change. We're going to need some new technologies. We're starting to see them hit the market and hit the FDA approval process for both point of service tests that can be administered by others and home kits that can be distributed throughout people's homes and used at home. And once we get those types of technologies online, we believe it's important to also get states and cities to come together with the federal government and pool their procurement and their purchasing capacity and project it out over a longer period of time. This is a very disaggregated market, the laboratory supplies market, and you have all these labs buying for short-term, small-scale purchase orders. And in light of that, it's going to be very, very hard to get the companies who manufacture these tests to make 10, 20, 50 times what they're currently making. That requires real investments in manufacturing capacity, an 8-week to 3-month timeline for them to build up the capacity to start producing at that much higher level. So this is actually a playbook that those of us that have worked in global health have used previously. We pooled together the purchasing power of 70 countries around the world and bought vaccines for low-income countries, and over many, many years, that saved 6 million child lives. I use we very broadly, but we pooled together the purchasing authority of countries that have been ravaged by HIV/AIDS, and together with the United Nations and the Clinton Foundation actually purchased long-term, large-scale supplies of antiretrovirals and saved millions of lives. We can do this in America for the laboratory supply market, but it's going to take leadership and it's going to take partnership. And that's why the Rockefeller Foundation issued a clear roadmap, and we're putting tens of millions of dollars behind its implementation so that it's not just a report, but it's actually a platform that cities and states can use to go ahead and access larger volumes of testing supplies over longer periods of time.
And I know that's a roadmap that many cities and states are already looking toward. Raj, thank you so much for the work that you and the foundation have been doing to ramp up U.S. testing capacity. In just a few moments, my colleague Brian Bennett will be joined by Senator Amy Klobuchar. But first, before that, we wanted to bring you behind the scenes to last week's Time cover, which has the same title as today's event, Finding Hope. And I know you will find hope and inspiration from the stories of the heroes who are on the front lines fighting this coronavirus.
What's up, everybody at Time? I'm here in Paris, currently at my studio, which is pretty empty, as you can see. Of course, I wanted to do something since the beginning of the confinement. The fact that you can't go outside made me think, all right, that's not something I'm going to be able to do for a little while. Then I realized how the streets are empty, how people are questioning when and how we're going to be able to go back in the street, but how people are looking at the street every day from their window. Maybe I could just paste an image that suddenly the sidewalk turned into something else. We'll add some here. Okay, guys, it's 5:30 in the morning. Just left my house and I'm on my way for the pasting. I love this street because it's very quiet. Of course, the crosswalk were beautiful, saying that, anybody worldwide can understand we have the same everywhere, and that I wanted to play with, having an anonymous person looking through it with kind of eyes of hope and question and just wonder what is going on out there.
If
finishing just in time, you see, the daylight coming. This is the street.
Depending in which situation you're right now, this image will talk to you differently. Depending if you're fully confined, if you have to go to work every day, if you have to go to the hospital every day. And that's what I wanted to create, something that speaks to all of us, depending of our own narrative, depending of what we're going through right now. So for me, if I'm reading this image, I'm looking at the hope of, looking at what's happening in the street, like we're doing every day, peeking an eye to the window of when life will come back. But, someone else might see differently. That was my secret touch. You can't think someone is going to do something illegal with a mask with your grandmother's curtain, right? You gotta stay the utopist. The artist always stay the utopist. Why? Because there's enough people being pessimists around. We have to always see a better world, see utopia, see how optimistic we have to be no matter what. Sending love, and hope all is well in America and across the world, wherever you're seeing this. I'm going back to bed.
You know that there's a risk. You're confident you can handle the concept of death and dying. But how do you prepare yourself for a pandemic?
I am headed into work right now.
So I'm about to grab my camera right now.
We don't know what else is bad going to come down the road, and this mission is long from over.
Rural county in southwestern Georgia has emerged as an unlikely virus hotspot.
175 have died.
It was just a shock to this community. It was just like a bomb hit here.
Ohio, don the mask. I have to fight the war with the weapons I have.
Si sta capendo che non bisogna aumentare le rianimazioni, bisogna aumentare le cure prima.
You took an oath to take care of people, but my children didn't sign up to get sick. My husband didn't sign up to get sick.
Working as a provider and as a photographer at the same time. What's my purpose in this historic moment?
We're seeing a disturbing rise in hate-filled attacks.
Hi, baby. You're working? I'm proud of you. Meantime, I'm worried.
It's really, really strange to me being both celebrated and villainized at the same time.
The number today is 9,693 beds we are creating for mayors and governors.
And already in the questions today, why aren't you doing more? On the back end of an epidemic, you didn't do enough. And that's sort of the fate that will be my life.
I really hope the work that I did is going to give something back.
Hello, I'm Brian Bennett. I'm Time Magazine's senior White House correspondent. Welcome to my home office in this time of social distancing. We're now going to welcome Senator Klobuchar. He's been senator for the state of Minnesota for 13 years. Hi, Senator Klobuchar. Great to see you.
Good to see you.
As I was saying, former presidential candidate. Where are you now? Tell us what your setup is here.
Well, I'm in my home office in Minnesota and with my family. My husband's with me. As you know, he got over the coronavirus after a really scary time in the hospital, and he's doing really well now. And it really taught me a lot about what these families are going through right now and what you just showed of those ordinary people doing extraordinary things. You know, it's those nurses and doctors that are holding up the phones to your loved ones because you can't go in and hold their hands, and then you can't even hug the people taking care of them. And it's one of the hardest things about this disease. So I really appreciate you showing their faces, sometimes behind masks, but all of the incredible work they're doing at the front line, because that's what saved his life.
How's your husband's recovery going since he got out of the hospital?
Well, it's actually going pretty well. It was about on the 5th day in the hospital, he took a good turn and his oxygen levels improved. And then he's only 52, so it shows and healthy that it can happen to anyone. So then he recovered in Washington, and then when he got better, we came to Minnesota. And the only lasting thing is when I tried to get him to clean the basement yesterday, it was like, oh, you don't want to get any dust? So I guess that's a lasting effect.
So what was it like to not be able to be with him when he was going through the worst parts of having the virus?
Well, I think as you've heard from so many people, I think it's hit almost every family. And by the way, my love and thoughts are with my friend Elizabeth Warren today, who lost her brother. He died. And it just shows, again, anywhere, any place in the country. And it's not just urban areas, it's moving into rural areas. And for me, I just wanted to be there. You're so used to visiting people when they're in the hospital because you want to be at their side, and it allows you to figure out more what's going on. And in my case, I talked to, of course, the doctors and nurses, but then I relied on him, and he had a really high temperature for 10 days, over 100 degrees, and it was really hard to figure out what was going on. And so remembering, I know for everyone, that you have to be extraordinarily patient because you've got doctors and nurses that have so many patients that they're dealing with. And so that was one of the things. I couldn't believe it. I'm now I finally got all their names because I've never been able to meet them. And I'm writing them notes, personal notes to thank them. And my husband, though, now he's really feeling good because he has these super immunities. So he's just gave blood. Went down to Mayo Clinic and gave his plasma, which they're really hoping is going to help people who get sick.
We're also writing letters in our house. My 8-year-old son has been writing letters to family members and friends who are healthcare workers on the front lines. You have pressing work that you're doing in the Senate. We'll get to that in a moment, but there's an election going on. And I was wondering, how are you balancing social distancing and the needs of retail politics going forward? Biden is running for president. He was your former political rival. Will you be out there stumping for Biden? What are your thoughts on that?
Well, I am, but it's, of course, in a whole different world, a whole different way. And one of the amazing things about Vice President Biden is just how he can always relate to people from his own personal tragedies that he lived through, losing his wife and kids, but also just everything he's done in the world. And I know from my own experience when he helped one of my friends once when she had lost her husband. That's what he's about. And so he's been doing it from his own house, just like every other elected official. I've been helping him virtually. We're doing events. I'm doing a Women for Biden event tonight, of course, by Zoom. And we're also doing a number of things. We did his podcast, and you just keep campaigning in a different way. And we don't know what course this will take in the fall, what the conventions will look like, but the issues are there. We've got the issue of what happened with this administration, and which there'll be many, many moments and debates, whether they're virtual or not, to go through exactly what went wrong and why we weren't more prepared as a country. But right now, as you're doing today, we are talking a lot about how we go forward. And a lot of that has to do with testing and being smart about following the guidelines state by state. We've got so many governors that have been leading. And for me, our governor's doing a great job here in Minnesota, Tim Walz, and we've been working together. And we just rolled out a major testing effort with the University of Minnesota and Mayo Clinic to help the people in Minnesota so we can get more and more people tested so we can eventually get our economy back again.
When you were on Biden's podcast, he called you his great friend. Did you guys have a conversation? Have you had a conversation about being on his short list for vice president?
No, actually, when I decided to end my campaign after about a year, and I started in a blizzard, as you remember, in Minnesota, and ended at this joyous rally with him in Dallas, and I couldn't think of a better way to end it. And I never talked to him about it at all. I knew it was the right thing to do. I wanted to unify our party. And since then, you've seen both my friends Bernie Sanders and Elizabeth Warren endorse him, as well as President Obama. And so to me, this is the united front right now. And that's where we are. And I never had any talks about him about any of that, because for me, what's important is winning this election.
If Biden asked you to be his running mate, will you say yes?
I am not engaging in hypotheticals because right now we have this, just as you are talking about with all these incredible guests today, we've got to deal with this pandemic, and we've got to do it as quickly as possible, both with the immediate, with getting those workers that you've shown the equipment and getting the testing out, the short term, which is slowly but surely and smartly helping our businesses and moving to get our economy and our workers. And then in the long term, something I've been working on, our democracy and some of the long-term effects we're going to see going into next year, making sure the money is being spent wisely, that the government gives out, and that there's accountability, and also making sure that we are employing people again.
Yeah, let's turn to your work in the Senate. You helped get $400 million for safer voting measures in the congressional package in March. Explain what's that money going to go to? What steps are being taken to make sure Americans can vote safely in November? What's that look like?
Yeah, well, this is really exciting because I think everyone remembers that scene of the people of Wisconsin standing in line in homemade masks and garbage bags just to risk their lives, basically.
Well, it looks like we're going to wait for the feed to come back up on the senator's feed there. We heard a lot from her about things that she plans to do. We have a lot of questions to ask her about what's happening right now in the Senate. Right now, she has been pushing for more money to encourage vote by mail, which would be important. Trump has criticized that. Here, you're back. Welcome back. And let's go to Trump's criticism of mail-in voting. Some of the money that you push for to be in that package would go to increase mail-in balloting. Tell us about that and whether Trump would try to interfere with that.
Well, he's not for this right now, but there's sure a bunch of Republican governors that want to encourage it, including in New Hampshire and in Maryland and Ohio and other places. The idea is simple: expand voting at home, make it easier for everyone to do it. Also make it easier so the polls are open for, say, 20 days before an election, so you don't have people congregating. And again, that's seen in Wisconsin, people in their garbage bags and homemade masks, standing in line while the president was able to order his ballot up by mail from Palm Beach, Florida. We can't have that happen again. And Ron Wyden and I have been leading this effort in the Senate. We were able to get, as you said, $400 million in the first bill, but we'd like to get well over $2 billion. That's what's going to need for the postage, the envelopes, and it's going to happen. We're already having so many citizens request these mail-in ballots because they know it's safer in the primaries, and then it's going to happen again in the general election. And people should not have to choose between voting and their safety. And just to show how nonpartisan this has been, some of the leading states for mail-in ballots are states like blue states like Oregon, but also purple states like Colorado. Utah, a pretty Republican state, is one of the leading states for mailing in ballots. Arizona is one of the leading states. And so we're seeing state by state citizens pushing to break down some of the barriers, like giving an excuse to get one of those ballots. 16 states still have that. You've seen 2 Republican governors waive the need for those excuses. There's something going on across this land, which we saw at its best in those voters in Wisconsin. They were mad. They were mad that the Republican legislature literally played politics with their lives, and they voted big. And I think my colleagues have seen that. So I'm very hopeful we'll be able to get funding and some of these reforms in place in the next major piece of legislation that comes out federally.
How concerned are you about political interference into public health decisions right now? At HHS right now, the former head of BARDA, Rick Bright, was shunted aside. He says he was shunted aside because he's pushing back on funding for the malaria drug and treatment of COVID. What are your concerns right now about the decisions that are being made inside the administration?
Major. You have not just him being pushed aside, which is just brutal, since he is a doctor and someone that was simply trying to look at the science and look at the facts and do what's right. But then you also had the Inspector General who had been chosen on a nonpartisan basis to lead the effort to examine how this money's being spent. And that is someone who had been literally through the Bush administration, the Obama administration, had served as the Inspector General for the Justice Department. And
so we'll have Senator Klobuchar come right back. She's just frozen just a moment, and her feed will come right back. I'm going to be asking her some more about McConnell's statements today about funding for. All right, come on, Senator Klobuchar, if you can hear me.
We're back. I'm back.
Fantastic. So we were just talking about any concerns you might have about political interference in public health decisions. Do you think there's going to be enough testing available for people to feel safe to open back up in Minnesota and other places?
I don't think we have that now by any means. And it has really bothered me that this president at the Republican convention said the words, "I alone can fix this." Then when we're in this major crisis of unprecedented dimensions, decides, and people's lives are on the line, literally says, "Oh, I'm in the back seat for the governors." Well, yeah, the governors should decide when their economy's open, but we should have a national testing strategy and a national vaccine strategy. And there is no way you can replicate that one state by one state by one state. I can't even imagine some of our smaller states being stuck with trying to figure out how they're going to develop a vaccine or develop the testing that we need. And but right now, we saw so much time being lost when the tests weren't allowed to be developed like they should. And that should be a national strategy. We were able to obtain the Democrats in the Senate $25 billion. We held our ground, wouldn't make an agreement till we got that for testing so that can be sent out across the country, because we're not going to be able to bring people back unless we have some kind of testing regime and know that it is under control and know who has immunities, that's serum testing and the like. That's what we need to do this. And we're starting to see that in some countries like Germany, where they're in much better situation because of their testing regime.
You've called for the USDA to establish a rural COVID-19 task force. I'd love to hear you talk a little bit about how you see the needs of small towns being different from the needs of big cities in this epidemic. And I'm also wondering, do you see bipartisan behavior in Congress right now? And does that give you hope for getting things done in the future?
You know, there is, or we wouldn't have been able to reach that agreement. And obviously, the president continues to play politics with this every day, finds a new issue that will divide people. But there was agreement to get that bill done. And one of the overlooked factors here are rural areas. Predominantly African-American rural area, the town of Albany, Georgia, was hit really hard. Some of our highest per capita death rates in my state and incidences of cases per capita are some of our rural counties. And we're starting to see it, especially in our senior homes, state by state by state. Needs are very unique: an older population, less health care closely available, less ventilators. You've got a population that doesn't have as good a broadband in many cases. So the distant learning is hard. I just was on with some of our high schools in our rural areas hearing that same thing. And so we have to make sure it's not one size fits all, and we have to start paying attention. Number one goal would be to have a president with consistent messaging, which we haven't had, to say, you know what, it knows no limits. It hits rural areas. It hits our farm communities. And I'd end with that. We have 2 of our major pork processing plants closed because there wasn't planning ahead when it came to inspections and standards. And we also are starting to see problems in our food supply, people waiting in line for food shelves because there isn't enough food. That's the last thing we need to have happen. So we're really focused on putting that through as a rural strategy to make sure that we are, again, bringing the testing out there and getting the food to the people that need it.
Thank you very much for joining us, Senator Klobuchar. It's been a good discussion. I wish you all the best of luck going forward. And I hope that you and your family stay healthy and safe.
Well, we will, and we'll improve our internet service every day. Maybe.
All right. Thank you very much. Good to see you. And coming up next, my colleague, Edward Felsenthal, will welcome back John Legend at our first ever TIME100 Talks. It will be the final interview, and there will be a special closing performance. So stick around for that. It's going to be great.
This pandemic is destroying life and livelihoods for too many vulnerable families. We've committed $50 million to the response to COVID-19. We are experiencing a food security crisis. There are more than 30 million American kids who depend on the school lunch program who are no longer in school. That was their main access to nutrition. So we're partnering with alliances around the nation to make sure those 30 million kids get access to their school lunch.
We're back now with John Legend. John, great to have you with us again.
Great to be back. Thank you.
Thank you. Thank you. This has obviously been an incredibly trying time for all of us. We've heard over the last couple of hours some really powerful perspectives on forging a path forward. And I wanted to ask you, what gives you hope? What gives you and your family hope? How do you stay hopeful?
Well, I think hope is something that I've always had, and I've always believed that we can do better, and we can summon the best of our human power to make the world better. It's hard sometimes to feel hope, though, because right now we're seeing a lot of people dying, we're seeing a lot of tragedy, we're seeing a lot of preventable tragedy as well. But I do believe in the human spirit, and I believe that America and the world are comprised of a lot of people who care about each other and care about making the world better. A lot of really brilliant people, scientists, doctors, people working in the medical field, a lot of people who are thinking about how we come back from this and come back in a way that is better than what we were before, not just normal, but is stronger and smarter than we were before. I think a lot of people are thinking about that, and there are always going to be forces that try to drag us back and that are reactionary. But I think there are a lot of great folks out there thinking about how we learn from this situation and become stronger. And if we try our best to summon the best of our human energy and spirit and ingenuity toward making a better future, I think we can do that.
I think you make a great point. A time of crisis is also a time to think about change. And I'm wondering, you've been so active, particularly in the areas of mass incarceration and voting rights expansion. How are you thinking about change that might come out of this crisis in those areas, positive or negative, particularly as we approach a major election?
Well, I think one of the areas we are very concerned about, of course, is the election itself and whether or not people can safely vote. And fortunately, I think a lot of people have been thinking about this for a while. People like Stacey Abrams with her Fair Fight organization and the NAACP Legal Defense Fund, which I'm part of the board of. There are organizations that have been out there fighting diligently and sometimes outside of the spotlight to make sure that people have their right to vote and that they know their rights and that they're informed about the restrictions that are being put in their way and finding ways to make sure that they vote despite those obstacles. And so we're going to fight this year to make sure that with this additional crisis, with this additional impediment of worrying about whether or not we can even be close to each other, that we make sure we get the maximal voter participation that we can. And I think a lot of us are fighting for no excuse absentee balloting and early voting so that people can spread out the times during which they vote and make sure we can do it safely, because we've seen even in Milwaukee that some people got sick from voting in the last Wisconsin election. And that should not be the sacrifice we're asking citizens to take to exercise what is a fundamental right of them being citizens in the United States. So that's one issue. We've been talking a bit about what's happening in our prisons and jails. Yes. And a lot of people think, well, these folks committed crimes, so maybe they should be lower priority. But please understand that those people are almost by definition prohibited from social distancing, and they're also around folks that are going back home every day to their families, corrections officers, other staff members that work in the jails and prisons. And so it's been a hotbed for a lot of infections because so many people are so close to each other and the conditions already aren't the best for them. And some of these folks are not, murderers and rapists. I think a lot of people are like, well, if there are a bunch of murderers and rapists in there, then let them, get sick. We don't care. But folks are in jails and prisons for all kinds of reasons. And some of them are only going to be there or only scheduled to be there for 3 months, 6 months, 9 months. And that should not carry with it a death sentence or the potential for a death sentence by being infected with this virus because they're so close to everyone else. So we need to think very carefully about who we really need to have in our jails and prisons to keep us safe. And those who aren't a risk to safety in our communities, we need to make them safe and make it safe for the corrections officers working with them as well. So that's another issue we need to think about. But these are things, we've been talking about for a long time, changing bail policy, changing incarceration policy so we don't lock so many people up for so long to begin with. But once again, I think this crisis is exposing some of the flaws in our society that already existed. We've seen it with healthcare coverage and the expense of healthcare. We've seen it with so many other issues with the social safety net, where all it takes is an event like this to really expose these things. But, these were issues prior to this crisis. And we need to think about how we reform our society so that we can better be prepared for the next crisis, but also so that the new normal is better than the old normal.
It's exposing the cracks in our system, as Angelina Jolie put it.
Absolutely.
Earlier. You called on Governor Cuomo to release nonviolent offenders and take more action to protect people in prisons through this crisis. Have you heard back from him? Are you encouraged at all by the response to that call?
We've seen some movement in New York. I haven't personally heard back from him, but multiple artists and activists have been speaking up on behalf of our folks in our jails and prisons. And I think there's been some movement in New York, but I think there could be a lot more. And you have to understand that part of the backdrop of this is something we fought for last year, which was reforming the laws in the state of New York to dramatically reduce the use of money bail and to give more pre-trial protections for people who are accused of crimes. When we talk about bail, I think a lot of people kind of assume that these folks are criminals and that they've been proven to be criminals, but bail is something that is charged to people when they're accused of a crime. And in our country, you're innocent until you're proven guilty. And a lot of our jails are filled with people who haven't been convicted of any crime. They're suspected of committing a crime. They're possibly accused of it, but the state hasn't proven that they're guilty. And we're locking them up because they can't afford to go home. And you'll know the difference when, for instance, Harvey Weinstein was accused of rape. He was charged a bail that he could afford, and he went home. He did not sit in the jail. But there are a lot of folks that, because of their financial situation, they're not treated the same way. And you should not be able to buy justice in America. It should be something that's fair for everybody. But folks who are poor and struggling, even if they're charged, $1,000, they don't have that sitting around waiting for them to, be able to pay these amounts. And so many of our jails and prisons, particularly our county jails, are filled with folks who have been accused but have not been convicted and just can't afford to go back home.
I'd love to bring in a question from our audience. This is from Lisa here in the U.S., and she says, a question for you. I'm an artist. I'm mentally drained, but also creatively fueled. Mm-hmm. Is it our responsibility as artists to produce right now or rest? What do you think? What role do artists have to play in this moment?
I think every artist is going to have to decide what they are inspired to do and what they can do. But I got to imagine that there's going to be a lot of creativity that comes from this time because people have some time to reflect and the world is slowed down in a lot of ways for them. And that could spark some interesting ideas, whether you're a writer or a painter or whatever it is. This time may be a time where you can create more. Of course, when you have kids like we do, being home doesn't necessarily mean you can get a lot more work done. I like to go off and write. I like to go to the studio and write. I like to be in another place. And so there may be some challenges when it comes to that, because if you're at home and you've got kids and you've got a family to take care of, you might not have the free time that it might seem that one would have if they couldn't go anywhere.
I'm right there with you.
Exactly.
3, 9, and 11. For parents, glad you raised that. For parents who are looking for activities with their kids, how long does it take to plan a wedding for 2 stuffed animals? Just asking for a friend.
That was a brilliant idea by Chrissy, inspired by our daughter Luna, and we put it together pretty quickly. The hardest part was just putting the rocks in order on the deck to make sure the aisle looked nice. That was my job.
Great.
And it was fun. We're just trying to entertain our kids, and I think they love it because they just like being with us a lot. And they're not at the age where they want to be with their friends more than they want to be with their parents, because they're 4 and 2 and almost 2. So they're not really missing their friends that much. They're excited to be with their parents so much. But I think once they get a little older, they'll probably miss their friends more and not think we're as cool as they think we are now. But for the time being, they are in heaven, hanging out with mom and dad.
I have it on both ends. One who thinks it's cool to be with his parents, and one and maybe a half who are ready to get out. I know you're going to do one more song for us, which is the title track from your new album, Bigger Love.
Yeah.
And you described it as a celebration of love, resilience, and hope. These talks and the issue that preceded it, the issue of time preceded it, the theme is finding hope. Powerful message for this moment. You must have sensed it coming at some level, or what was it?
It's crazy because I wrote it last year and I didn't know the circumstances under which I'd be releasing it, but here we are. And I think people could use a little shot of hope and love and a moment to dance as well. I'm going to be playing it on the piano, so it won't be as beat driven and danceable as the record is, but hopefully people get a chance to play the record. And I think it's a fun record. My kids like to dance to it, and hopefully it'll inspire some dance breaks in your homes all around the world.
Well, I can't wait to hear it. Thank you so much for being with us. We'll let you have the last words of this program in music. No better way to end on the topic of finding hope than that. So thank you.
Thank you.
Okay.
I don't want to think about nothing, just watching you dancing. Feel like the beginning of something. And in the end, all I want to do is just fall in. I don't want to think about nothing. Everybody got so much to say. Every time we push it away. Every day a reason to stay. Another new something. And in the end, can't nobody do us in. I just wanna think about loving. We got a big love. Won't ever give it up, no. We got a one-way ticket, love. We ain't going no place but up. Nothing can stop us. No one can top us. Oh, we got a big love. Won't ever give it up, no. We got a one-way ticket, love. We ain't going no place but up. Nothing can stop us. No one can top us. We got a big love. Oh, we got a big love. 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 Thank you so much.